Thank you very much, Marco. My name is Alexander Alscher. I'm CEO and founder of Samedi, and recently we heard about how to make patients happy or even help them. Now we're talking about how to save the patients, and that is what we are doing. We're organizing health. We're in Germany the leader in patient portals for hospitals, but we are much more up to this. And the claim is in terms of organizing health to manage really the triangle of providers, saying the doctors, hospitals, but also the patients and the payers, so the insurance companies or other healthcare institutions which are in the end paying the bill for the patients. And so our goal, our mission is really to increase the service, to increase the quality, but also reduce the costs and automate the processes for providers and payers. And that is what we're doing now since over 15 years. We have the focus on process excellence that we're really trying to understand and to model it in our software. We're also having a really high claim in security. We have European patents for our security mechanism, and we also have a focus on the integration part. So we serve more than 40 practice systems, more than 10 hospital information systems, that we're really one of the part in the whole healthcare ecosphere. So we really try to focus from the patient towards the GP, towards the specialty in the hospital or in the rehabilitation center with the managed care institution. That is what we are going to try, or what we are doing in managing the patients. And of course, it starts with as simple as an online appointment booking, but also then the online check-in, anamnesis files, the admission forms, treatment contracts, also with advanced digital signature by the patients. Then in the hospitals, the resource planning also up to all the resources for the surgery. And in the end, also video consultations, as well as medical records exchange and the whole payment for special contracts. That is what our whole software suite includes, over 80 products and modules. And we're doing this starting with practices, with clinics, then also insurances. 2012, we were one of the first in Germany setting projects with the Techniker Krankenkasse, hospital chains, Charité, Asklepios, then over public health with federal states like Saarland, Baden-Württemberg, and now also we are serving pharma companies who set up medical projects. Especially in Germany with the hospitals, there's a big discussion of how many hospitals are needed. So there is a discussion that hospitals are dying, and we see, of course, the digitization as the last resort to save it. Once, of course, there's too much paper, you go in a hospital and you sign 6 times the same paper form, and it's, of course, also a matter of ecological with all the trees sacrificed for the paperwork. Then there's a lack of information, so we have redundant diagnostic, that it's done the same time over and over again because they cannot seize and cannot access their data because it's not there. And finally, it's a lack of HR, IT, and also AI, that there's also above 30,000 deaths each year due to false therapies. Therefore, Germany and the German government has set up the Hospital Future Act already back in 2020 to support and eventually to foster digitization in hospitals. So they set at 4.3 billion across 11 areas, and digital documentations, of course, first, but our focus is the second. It's a patient portal. So we're speaking there about digital admission, digital treatment, and digital discharge of the patients. And there are 11,030 applications from hospitals, and we've been really successful in the last years. We are the market leader in Germany. So we won in the years over 250 hospitals, almost 50% of them are using Samedi for the patient portals. And so really became one piece of the whole ecosystem atmosphere in the healthcare IT. We also had to develop much about new interfaces, about identity providers, single sign-on, of course also improving the interface towards hospital information system, archive system, but also practice system. And that is where we also see our next growth as we become really one big part of the whole healthcare IT, that we are also one of the players for the public health. And so what our take there is that we say really to manage healthcare in real time, that they do not have policy makers or managers have to think about where to set up like a physical entity, but to see actually where is the need, where is the supply, how can match it, can we steer the patient towards them. And we did it really successfully for federal states and also this year as one of the pilots for the pediatric video consultation. I guess everyone, as me, we were like so happy if we could have for our children not only to go in the practice and get with more diseases out as you got in, but just to have the chance to have an online consultation. And we did it in one of the largest population dense areas in Germany, in Nordrhein, for more or almost 10 million people in the western part, with the goal to relieve the burden of the emergency child doctors, the emergency service practices. And within 3 months, we set up the whole project with a result with a huge satisfaction, 88%, with an NPS score of 62%. Industry benchmarks at its top, it's like 40%. We were like at 60%, but of course it's obvious. I mean, it's like caring about child diseases and getting very fast help there. We had 70% relief of physical emergency centers. We had a waiting time, an average of 1 minute, treatment time of average of 7 minutes, and 45% case closure rate. So really one of the prime examples in Germany for digital healthcare, even mentioning by our healthcare minister, Karl Lauterbach, really as one of the prime examples. And that is also our goal for the next growth phase, to go more and more in these larger healthcare projects as we have the whole software, as we have the whole project management expertise, and that is our mission for the next year. And so we're really looking forward to speak with you about partnering for this kind of mission to save the healthcare system and public health. Thank you very much. That was it for Samedi, and looking forward to work with you together on the next healthcare level.